Let's get the show started from the health sector. The Lagos state government has transited to the most important stage in its rollback strategy against malaria. The state is now the first subnational in the country to launch the Pathway to Malaria Pre-Elimination and Digitization Program, an initiative aimed at reducing the malaria burden through digital innovation and strengthened public-private sector collaboration. Governor Babajide Sanwo-Olu launched the tech-driven health initiative at the Eko Hotel and Suites, Victoria Island, where he also calls on individuals to test before treatment.
Malaria is a major public health concern in Nigeria, with an estimated 68 million cases and 194,000 deaths due to the disease in 2021. According to the World Malaria Report 2024, Nigeria accounts for 27% of the global malaria cases and 31% of malaria-related deaths.
Ladies and gentlemen, thank you very much.
In a bid to curb the spread of malaria in Lagos, the state government is launching a Pathway to Malaria Pre-Elimination and Digitalization Program in partnership with other stakeholders in the health sector to improve case management and link patients to social health insurance schemes. The State Commissioner for Health, Professor Akiabami, gives a pictorial explanation that shows that not all malaria symptoms are actually malaria.
You can see there we've come down. We're now at 2.6%. The red bar there is 1%. I think we can see that we are on our way. And if we keep up the pressure, we should soon hit that red bar of pre-elimination. So our strategy is no longer treat without a test. We want to drive the use of bed nets, and we want to make sure that we're using our medication judiciously. So Lagos State is very much, in a position where we might be on the verge of pre-elimination. If we just get our ducks in a row, then we might get there sooner than we think. Now, this is a typical waiting room in our primary healthcare or general hospitals, or even in the private sector, where a majority of people are coming in and describing that they have malaria. And I think this is as a result of institutional memory or community memory. When malaria used to be high, people used to understand that any fever was malaria. So people come in and they tell their doctor that they have malaria. We know in the medical fraternity that there are myriads of causes of fever that can mimic malaria. So as a good professional environment, we need to be able to distinguish these categories and give the correct amount of treatment. One thing that we don't do much anymore is we don't examine our patients. So we're using this opportunity to advocate that we must do a thorough history and examine the patient. At the end of the day, the doctor says, well, I know you think you have malaria, but we're not doing any guesswork here. We're going to test you. And they do a test, and lo and behold, the test is negative. So, in essence, our strategy is test, treat, and track. We plan to strengthen service delivery, integrate digital health solutions, work on our community. Our community are very important. We need to educate them. We need to reduce the release of anti-malarials so we don't develop resistance to the anti-malarials that we have. We need to stop giving arbitrary antibiotics. We need to do proper investigations and make sure we arrive at the diagnosis.
About $20 billion has been set aside to deepen access to primary health care in Lagos State through the Impact Project set up by the federal government to also improve malaria prevention and treatment services.
The project's overall envelope is $650 million, and at the national level is led by NMEP and MPACDA. Then at the state level, we have the State Primary Healthcare Board and the State Malaria Elimination Program. Your Excellency, sir, when we started, we were just in 18 states, and Lagos State was admitted to implement just the malaria component. But today, the Impact Project is in 28 states, and Lagos is implementing both components, the malaria components and the immunization components. And just to note that these are the amounts available, but for this year alone, for Lagos State, there's a $20 million earmark for these two components in Lagos State just for 2025. Earmark, I use the word earmark because you can only get it if you implement the activities. If activities are not implemented, that fund may not be available, so it needs to be implemented.
Targeting the vulnerable group, we're looking at our pregnant women and children under 5 to reduce morbidity and mortality from the disease. The component uses performance-based contracts to deliver malaria services, malaria interventions, including providing anti-malarial medicines and commodities. We're looking at our insecticide-treated nets, malaria test kits, our artemisinin-based combination therapies, otherwise known as the ACTs. We equally want to conduct social and behavioral change communication on malaria and improving diagnostic accuracy, among others. So the service delivery target for 2025, we're going to provide over 2,000 ACTs. As at the moment, February 2025, we've done 144,000. 2 million, sorry. We've done 144,000. For malaria tests, we want to conduct about 2.1 million tests, and so far we've done 110,000. For sulfadoxine pyrimethamine, which is to prevent our malaria in pregnancy, we intend to provide over 720,000 SPs for our pregnant women, and so far we've done 32,700. Artesunate injection to prevent severe malaria, we want to make available over 130,000 vials, and so far we've provided 14,390. And insecticide treated nets, 273,411 is what we're looking at to provide.
The World Health Organization and other partners are willing to support the Lagos State government to curb the spread of malaria.
We'll provide the technical expertise to ensure the successful execution of set objectives and contribute to the sustainable pathway for malaria pre-elimination while strengthening public-private sector collaboration for further improvement on malaria case management. We will provide technical assistance to ensure that only true malaria cases receive medication.
With the pre-elimination of malaria as clearly exemplified by the declining positivity rates when we think about malaria rapid diagnostic testing, both in the public and the private sector. For us, this clearly identifies and demonstrates the political will that the Lagos State government has and the unwavering support of Mr. Governor to ensure that we can have the elimination strategy become a reality. And also, as you can see in the room, the number of permanent secretaries in Lagos State, especially for the primary healthcare, shows that primary healthcare is at the crux of what is going to make this a success. The private sector in West Africa, and indeed Lagos, represents about 60% of private healthcare. And that shows that we are very committed in this process of elimination of malaria as a nation and as well as Lagos State to play our role from the provision of commodities to strengthening logistics support to local production of pharmaceuticals, both long-lasting insecticide-treated nets, ACTs, and rapid diagnostic kits, to capacity building and institutional strengthening, working alongside Lagos State government and the federal government, and also leveraging on the use of digital tools to get access to quality data to make more informed decisions on the elimination process.
Right there at the event, the Lagos State Governor Babajide Sanwo-Olu as well as the Minister of State for Health were tested for malaria, thereby showcasing malaria control in Lagos State, a step commended by the federal government.
This momentous project will not only set the track for malaria pre-elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer. I want to emphasize that this project is in line with the renewed hope agenda of President Bola Ahmed Tinubu and the renewed vigor of the Federal Ministry of Health and Social Welfare on the Rethinking Malaria concept that was launched in April 2024 and is aimed at fast-tracking the malaria elimination goal through strategic shifts. We have continued to make progress in this regard, and the inauguration of the Advisory on Malaria Elimination in Nigeria, AMEN, the development of pragmatic costed plan of action, the expansion of primary healthcare facilities, training of frontline health workers, and the initiation of domestication
of affordable medicine facility for malaria to make malaria treatment more affordable are all testament to the progress we are making. Your Excellency, distinguished ladies and gentlemen, the ministry is taking these steps in order to reverse the undesirable trend of being the highest burden malaria endemic country globally, accounting for 27% and 31% of cases and deaths, respectively. I am confident that the Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such pace-setting initiatives like this program. Furthermore, Lagos has been consistently the lowest malaria prevalence state in Nigeria, as evidenced from all the malaria indicator survey conducted in the country, with the most recent result in 2021 showing 2% prevalence, hence indicating a tendency of attaining pre-elimination when concerted and consolidated efforts are put in place.
Governor Sanwo-Olu insists all pharmaceuticals must test before treatment and prescription.
We had to change all of that narrative. The eradication of malaria is not just a good health news. It is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a pin, that we need to have, a pre-elimination, the campaign for it. We need to have it, and we need to be able to dot it everywhere proudly. And so this program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time. This is digital. Long are those days when you need to take a whole full blood from your body to just do a simple malaria test. I was asking for my bottle of Maltina, because those days when they take your blood test, they must replenish it with a bottle of Maltina. But you can see that with just a small prick, and in no time, you can actually, that's what digital life, has done. And so it has helped us by strengthening partnership with the private sector. We'll expand access for quality care. It will help communities to have the knowledge and resource. It will build a culture of preventing that leaves no one behind. And that's a message we need to come out of from here. All of us sitting in this room must immediately turn ourselves into an advocate, into a cheerleader, to be able to carry this message forward, to be able to tell everybody that needs to know. Go into our communities, pass on this message that this pre-elimination launch program had started, and it's for all of us to see it, to buy into it, and to work with it. The benefit of eradicating malaria goes beyond just health. A malaria-free Lagos, and indeed in future, a malaria-free Nigeria, is achievable in our time. And we've all put our minds to it. It's something that could be done. To my fellow Lagosians, the fight belongs to each of us. Let us embrace a preventive measure like eliminating mosquitoes, adapt a test before treatment. And I think that is a message we need to take away. All of our pharmaceutical establishment, ensure that we can pass this message. Test before treatment. It is so important that we do not just take this for granted. Let us ensure that we can take this advocacy into our communities, into our nooks and crannies, and show truly, really, that once we have started this campaign in Lagos, it will go around every part of the city. We can rewrite the history of malaria in Lagos, and it is in our hand. It's all of us in this room that can help do that.
The event was rounded off with the unveiling of Pathway to Malaria Pre-Elimination and Digitalization Program in Lagos that advocates tests before treatment in order for patients to receive proper diagnosis for malaria.